Thank you, Dr. David. And I got to tell you, following up all of these different groups today is really intimidating. Very intimidating. So the Family Safety Center opened in Tulsa in 2006, one of the first 15 in the country. Today, there are 2 more in Oklahoma, one in Oklahoma City that opened last year, and one in Shawnee, Oklahoma, serving Pottawatomie County. There are 3 of us now. There are 130 of these across the country, and there are 30 worldwide. Why is it important? In Tulsa's case last year, we hosted 5,600 adult survivors. We hosted 2,000 of their children, and we hosted 1,500 accompanying people. And it's important for them to come see us because this is the system that they're navigating, that you're navigating if you're going through a family violence or intimate partner violence environment. In 2006, we started out with 8 partner agencies. Today, we have 13 partner agencies on site and 10 in the community that are working with us on projects to help keep our families safe, to provide education, to provide prevention. You can see some of our partners here on this list, and we're so excited that we're able to bring innovative program and systems analysis to the community as we figure out how to better educate and eradicate violence. The Family Safety Center serves as the backbone organization for this partnership of agencies. We have been charged with being the neutral convener of this group so that we're able to keep that wheel of services, keep those service providers working together for a seamless experience for our families. In our location, while 86% of those people come to us from law enforcement, it's a walk-in system. There are no reservations required. You can access whatever services you need to have to keep you safe. And our mission of protection, hope, and healing is now kind of morphing into prevention, intervention, and healthy living and well-being moving down the road so that we're able to have a longer-term effect and effective programming so that no one dies. Since 2013, none of the services that have been accessed by our victims in our community, out of those people who are entering our doors, not one has been killed by their offender since 2013. Those are staggering statistics. And as I mentioned, system assessments, our practicing professional partners have been assessing systems. So we've done one for the protective order court. We are now engaged in the family court assessment process. We're participating in national demonstration projects to identify victims of multiple trauma, and our Camp Hope program is establishing hope and resilience for kids, and we're measuring outcomes with that. So what's next? What's next? Critical incident intervention is not the end-all be-all. We have to think beyond, and we have to go deeper into our community, and we don't know what that's going to be. So we call it IT. Does that look familiar? It's not the same scary balloons. You're not going to see the clown. This is hope and resilience rising. And when we know what that picture is going to be with our partners, and our partners are our survivors, they're our current partners, they're future partners, they're funders, all of us working around the table to be able to develop this and implement this strategic plan that is survivor-driven, partner-planned with a campus environment like Google. We want to be the Google in this business, right? So what does that mean? We know that timely access to services and to trust are what make the difference in the well-being of our families and for our staff. We have to be trauma-informed. Our staff is just as liable to experience secondary trauma from dealing for all of those violent incidents. We want to make sure that we are helping their well-being and encouraging longevity of employment. We perceive this as being a training lab for higher level students. With all of the universities and the medical schools we have here, what better place to have training for your future professional generations than in real time, on-site opportunities for learning? That's great news. That's better news. And research. We're all trying to figure out how we measure our outcomes. Is the fact that no one dies a significant outcome? Yes, but there are others along with that. And it also ensures whole community engagement And as we keep going through the systems that we work, we believe that this is really going to make a big difference for our community. So we're looking forward to seeking your suggestions and your input so that we can continue to move this needle. When we show you the picture of what it is, I promise it will engage your passion, and you will definitely feel like we were moving in the right path to instill wellness and health in all of the citizens of Tulsa.